Michigan is making progress in the fight against COVID-19, but the threat still remains even as some restrictions are being loosened. So joining us for 7 Up Front this evening is the Director of Infectious Diseases Research at Beaumont Health, Dr. Matthew Sims. We thank you for being with us.
Oh, happy to be here.
Well, this is a conversation this evening about remaining vigilant. So what would you say as the holiday weekend is coming up? Many excited to get outside, see family, friends. We're talking about 58% of Michigan adults fully vaccinated. Is there still a risk out there of an outbreak or spike?
There still is. There are still a lot of people not vaccinated. And of course, the numbers are really looking at 16 plus. We've just started vaccinating the 12 to 15-year-olds. So those numbers are not quite as clear. And of course, there's everybody under 12 who hasn't been vaccinated yet. While they generally don't get very sick from the virus, they can certainly get infected and spread the virus. I have trust in the virus. I trust the data, trust in the vaccine. I have trust in the data that's been generated that says the vaccine works. So I think that the people who have been fully vaccinated are well protected. That said, the people who are not vaccinated still don't have any protection and can get infected. So they still need to take the precautions of wearing masks when appropriate, avoiding being in big crowds unmasked, and being careful.
So we do know recently the CDC issued new mask guidelines, and it allows people who are fully vaccinated to go maskless in most situations. Many states, including right here in Michigan, following suit, but of course this coming at a time when vaccination rates appear to be slowing down. So do you think these new guidelines came too soon?
I would have personally liked to see them come a little later, in terms of the not necessarily later date-wise, but later in terms of having a bit more of the population vaccinated. I would have certainly liked to see a little bit more of the 12 to 16-year-old group vaccinated, and definitely more of the adult population. That's the population that's most at risk. That being said, we do have to show to the people who have stepped forth and gotten vaccinated that we know that the vaccine works, and we have to start allowing them a little bit more freedom. And this is what's going to do it. This is going to help people move forward, realize the vaccine is important. And as we move forward, hopefully it will help address people who are more hesitant, who are worried about the vaccine, when they see, the people who are vaccinated out there without masks and doing well. Now, of course, the concern is how many people who just absolutely refused to wear masks before and now can't get told, you can't tell them from the people who are vaccinated and not wearing masks, how many of those people will now be going maskless when they shouldn't and putting themselves and others at risk.
Well, doctor, we know Beaumont had a large number of patients there. Beds were full. We saw that for a while. And of course, now visitor restrictions changing. So what would you attribute that to?
Again, the numbers are down.
Yeah, okay.
Just like after the last surge, we eased the restrictions on visitors because we don't want to hold visitors back. We don't want sick people to not be able to see family members, to see their loved ones. We just want everybody to be safe. So as the numbers came down in the state, as we have less people with COVID admitted, as we have less COVID units that people may have to, be near or walk through, we don't, we don't have to be quite as restrictive now. So it's being eased up a bit. It's still just one visitor at a time. They still have to wear masks, but they can swap out with other visitors. As opposed to previously when we could just have one visitor and they had to be fully vaccinated. Now it's one visitor at a time. I think up to 3 a day, and I don't think they have to be fully vaccinated anymore. If I recall the last part of the change.
Yes, so much appreciated, and especially for people with loved ones in the hospital, that the rules can change as we change and get safer as a population out here in Michigan. Vaccine hesitancy, Doctor, just a last word on that. You know, we've talked extensively about that in our newscasts. Some people still, aren't being reached, for their own beliefs and their own sense of trust. And I've even seen health professionals who feel that way. So can you just give us a note to go out on as we head into the holiday weekend for someone who may be considering a shot?
Yeah. So, I mean, the best thing I can say is the data on how safe and this shot is and how well it works is very clear. It's safe. It's effective. The side effects overall are minimal. And, I've said it before and I'll say it again. The single, biggest thing I can say that just shows how much belief I have that this shot works, how much trust I have in the data is the second I could get the vaccine, I got the vaccine. The second my wife could get the vaccine, my wife got the vaccine. The second we could give it to my oldest daughter, we gave it to her. And the second that my youngest daughter is eligible, we're going to give it to her. So we believe in it. We trust in the data. We know that, you're probably going to have a little bit of side effect. They're mild. It's easy to get past, and then you're going to be protected.
Well, that personal information, a powerful example. Dr. Sims, thank you for joining us tonight. We appreciate your time.
Oh, you're welcome.
All right, and we'll be right back.